Hi, I'm Siobhán Fletcher, one of the journalists up at Manx Radio, and welcome to this latest edition of our newscast.
Okay, I'm Teresa. I'm Chief Executive of Manx Care.
Perfect. Okay, so we're talking through today some more savings that Manx Care is having to make. The headline here is that in September the overspend figure was around 16 million. All these different schemes and interventions we're going to talk about now should get Manx Care down to around 8 million overspend. Can you just briefly run me through some of the measures that we're sort of going to see go into place?
Yes, so this is, as you say, £5 million worth of additional schemes on top of our existing £12 million worth of cost improvements, which are already in our plan. And these schemes are largely short-term schemes to help us reduce that overspend for the rest of the financial year. So these things are, we have taken the decision to temporarily close our mental health recovery college. We are also not going to renew our mental health online contracts regarding Cooth and Quell. And we are also withdrawing our out-of-hours social worker in adult social care. That's not to say there are no social workers on duty out of hours, but this is a level of duplication, and actually we believe removing this service has no impact. We've also taken the decision to continue for a further 3 months the weekend closure of the minor injury unit at Ramsey. We've also talked about the elective cooling, and I think we've talked a lot about that in terms of that temporary reduction of some theatre lists over the course of the next few months. We have put in additional scrutiny around the use of bank staff and agency staff, and that's heavily scrutinised by our clinical professionals. We will always make sure we are safe, but this is about optimising our rosters and being able to ensure our frontline staff are able to work at the front line. We're also looking at how we accelerate some of that work with our tertiary providers, so where patients don't need to have to travel, but also we're asking our tertiary providers to clinically validate the waiting lists of island patients who are on waiting lists for off-island care, and understand whether those can be delayed or not. Obviously, that's a clinical process, so that will be subject to the clinical validation by the teams across in the UK, and will only be done if those teams feel that is clinically appropriate to do so. A further scheme is that our medical director has been doing a very detailed piece of work around consultant job plans, and the first part of that piece of work is to look at additional programmed activities for medical staff which are not frontline linked to direct patient activity. So these are sort of leadership roles that can potentially be consumed within the overall job planning contract. So again, that work has been accelerated. That would be a recurrent scheme, so that scheme would continue beyond the end of the financial year, but has been brought forward to try and achieve some savings in this financial year. As I say, the majority of those savings are very short term, but there is just one or two that we potentially would continue longer term.
At the core of all of this, what is the root cause of the overspend that Manx Care is facing?
So in essence, we had to set a very ambitious cost improvement programme target at the start of the year. Manx Care has delivered around £10 million of cash out savings over the last 2 years. But this year, in order to have a balanced position, we needed to make £19 million worth of savings. When we risk assessed all of those savings, that reduced down to 12, which is why we had a gap. Also, during the course of the year, we have been impacted by movements in our monthly spend, so increased costs of off-island care, impact of high-cost placements, individual drug costs. All of that has put essentially a £9 million cost pressure into the organisation. So the level of savings we need to achieve to offset that has increased considerably.
I think the main thing people are going to take from some of these measures is kind of like we had last week with the elective surgery list, is that these are now patient-facing impact the frontline services. The tertiary partners, asking them to slow down activity for electives, so it's more electives really, it's around 215 patients. Now, that was clarified that that's not older hay, it's not kids, it's not Clatterbridge, it's not cancer services, it's not neuro, but for example, some of the non-time critical procedures there was orthopaedic, so hernias, we talked last week about knee and hip, things like that. Again, the mental health, the slowing down, stopping early intervention pilot schemes, which you're not saying will necessarily never be picked back up again, but we're slowing down what we know and we get told is key early intervention. This is all more patient facing. So what is Manx Care's message to the public with this?
So Manx Care's message to the public is that we have attempted to choose the schemes which would be least impactful, and we will monitor them incredibly closely. We take our financial responsibilities really seriously, and ultimately this has resulted in us making some unpalatable decisions in order to achieve this further round of savings. We will always put the safety of our patients first, and we do acknowledge that asking the UK providers who have patients on the waiting list to consider cooling down their services where clinically appropriate, just like we've done here, there is an impact because ultimately a patient may have to wait slightly longer for their treatment, and we know that has an impact. But we are in that very difficult place of making some incredibly difficult decisions in the short term whilst we move forward with the wider piece of transformation in order to achieve sustainable high quality healthcare services for the island. Our focus with the £12 million worth of savings is around those long-term benefits which take costs out whilst also improving provision, and things like medicines optimisation and better medicines management are classic win-wins. We save money, but we also improve the outcomes for our patients and service users. And those are the types of transformation programmes and savings we really want to focus on. But we have an in-year problem. And we must take steps to reduce the overspend.
The public kind of seems to have lots of ways they think Manx Care could make savings. The appointment system, so people receiving letters and the postage cost of that when the letter arrives and the appointment's been missed, and then the cost of an appointment missed. So electronic communications, all these different things where they're like, why is this not in place? Why not spend money in these sort of areas now to save money in the long run?
Yeah, and we absolutely are. And again, a lot of this is timing, because we can see opportunities for the organisation to take several £1 million worth of costs out year on year without impacting any frontline services. And the administrative processes that you've just described as just a case in point, we've already started that work. And so the organisation is confident that it can continue taking out £10 million worth of cash releasing and efficiency savings every year moving forward by just the things like that. We are looking at an app which will really revolutionise the way we do appointments. So this will be an app which will have all patients' appointments on it, including their letters if they wish, and that will really revolutionise. It will stop us having to spend £300,000 per year on postage. It will stop the issue of missing letters. It will allow people to be able to have their appointments on their phone or their device or their iPad. And it is a game changer, and we're pushing that really, really hard, because that will be something which has a huge benefit to patients whilst also saving a significant amount of money.
We know Manx Care was established on the 1st of April 2021. It's still in its relatively early stages, really. Your own organisation describes this as marking a once-in-a-generation shift in the way we do healthcare here. Why does that shift seem to be failing at this point?
I would argue it's not failing. I would say we are Manx Care is a new organisation that when it was established, we were in the midst of COVID. The first 18 months, almost 2 years of Manx Care was still very much in COVID. I remember the first year of Manx Care starting, having the highest number of inpatients with COVID that there had ever been. And then we moved to living with COVID. And then in year 2 of Manx Care, we prepared for comprehensive inspection across all of our services. So we invited the Care Quality Commission and Ofsted into all of our services. And as a result, we have almost 90 inspection reports of comprehensive inspection. And we have been responding to that. We also are improving the quality and the performance management and the financial governance of the organisation. So getting much better at the data we have available to us, the reporting on outcomes, and really improving the safety and the quality of the services that we provide, whilst also trying to transform services and look into the future and plan what services need to look like for the population in the next 5, 10, 15 years. So I think it was always a big ask in the context of COVID, comprehensive inspection, and Sir Jonathan Michael's funding formula not able to be offered to Manx Care.
Well, just to jump in there, I mean, he gave you that funding formula. The Manx Labour Party we've heard from this week, they say the health service has been routinely underfunded this entire time that Manx Care has been in existence. So do you agree with that?
Absolutely. The evidence is there. So the funding formula from Sir Jonathan Michael's was very transparent. And we know what we should have had as a settlement, and we know what we've had. And there is a very clear gap. However, we do acknowledge as an organisation that the economic landscape has changed, and probably that funding formula is no longer affordable. But what we have is quite an ambitious mandate, and we still have full sign up to the 26 recommendations of the Jonathan Michael's report. So what that means for us as a system, and this is broader than Manx Care, is that we will collectively need to make some difficult choices about what the funding settlement for health and care can really afford. And that's an active and ongoing discussion. But yes, I think if you just come back to the funding formula, Sir Jonathan Michael said was needed to transform services and create a fit-for-purpose health and care system for the island. No, we have never received a settlement which matches that funding formula.
So you're trying to make all these savings, but like I say, some of these are hitting, it's mental health, it's out of our social work being withdrawn, it's quite key interventions being taken away here. What's the approach then if there's a patient failed during this? Will that policy change?
So this is why the monitoring of all of these schemes is really important. So we have to understand the impact. We don't anticipate there would be impact. So Recovery College is not a statutory service. There are still alternative services to put a patient or service user into who may have accessed recovery colleges. There are still alternatives. It's a different pathway. It's a different provision. But yes, the monitoring of the implementation to ensure that no harm has come as a result of these schemes is really important. And we have processes to identify that and review that. And as I say, sometimes these schemes potentially are likely to make savings which don't materialise. Well, then of course we will stop trying to push that. But it is about making those short-term savings. Nobody wants to make additional savings halfway through the year. It's very disruptive for staff, and we have to pay tribute to the staff who work incredibly hard in responding to these continued challenges and work with us on this. But it's never ideal to have to sort of go back and look for additional savings partway through the year, particularly as you're heading into winter. But it has been necessary, and the board has looked very, very carefully at the schemes that have been agreed. There's a number of schemes we just absolutely said no, we do not believe we can implement that safely.
We basically here seeing some of the ambitions of Manx Care being stripped away. I mean, this is early intervention schemes. This is things maybe that you say aren't statutory requirements. Are we seeing some of that ambition that we saw Manx Care be set up in basically being stripped away then, rather than necessarily core services? I mean, is this the kind of icing on the top that's been scraped off? Like, what are we seeing here?
Yeah, no, I think that's fair. So Recovery College is a real passion of mine. It feels really important to have a psychosocial educational model of supporting people in the recovery from their mental illness. It is an early intervention. It isn't a core or a statutory service. We're not mandated to do it. It's something that we feel is important as an organisation, with our ambition of moving services out into the community and also supporting early intervention. So it is difficult from that perspective because it's against some of the principles of Manx Care in really wanting to provide those enhancements. But actually, we haven't got the budget for it. And it is something which can be paused and removed temporarily with very little impact, and certainly preferable to, say, stopping frontline mental health care. Which wouldn't be acceptable to us.
We've got the Culture of Care Barometer from the BMA has been published, but some of the comments on that, it's again that they want to see management cut and things like this, and again that's going to be the comment from the public on this. At what point will we see just a gutting of that middle management that is perceived as not being needed to be there?
Yeah, no, and I can understand that, and we within the saving schemes that are already in place, there is a reduction of managerial roles, and looking really, really closely at those corporate and back office functions and protecting frontline. With regards to the barometer of care, we take the comments of our medical colleagues and this survey really, really seriously. We are listening. We know it is really, really difficult. So, for example, our medical colleagues, we're still in pay dispute for the last 2 years. So we haven't been able to settle the pay award for last year and for this year. Medical colleagues have seen other jurisdictions and England settle with their medical colleagues and get a much more favourable outcome than what Manx Care is able to offer. And we are also trying to progress transformation at pace. So we do understand that often the ask of our frontline staff is a big ask. And some of this change does not always sit comfortably. But we absolutely are committed to working collaboratively with our medical staffing colleagues and indeed all of our colleagues. That includes our nurses and our allied health professionals and our managers. We have looked at the management costs of the organisation, and they are around 2%, which benchmarks quite low. And if you look at the Darcy report, which has just been published in England, it is basically saying we need more managers. A lot of our managers are clinical managers, so they're clinically qualified, leading services whilst also professionally leading staff groups. So perhaps just because they have a manager in their title does not mean they are without a clinical qualification or not professionally leading a number of our frontline clinicians, because actually that's not correct.
And you sort of compared it there as well. There's a comparison with some of these measures with things that happen in the UK as well, and is kind of already in place there. The government there has not been shy about saying that they see the NHS as it stands in England as broken. Is it right to be copying the UK on some of these measures? Should we not try and be a bit more aspirational? Or is this that we're seeing the aspirations and then not the money to back it up?
I think we've got huge aspirations here and huge opportunity. We are an integrated health and care system. And I think we have so many more benefits to the UK. Yes, in some ways, we have been slightly behind, and we are trying to transform and bring in some of those new service models, which we know work really well in the UK. But equally, we are in a much, much stronger position in terms of the quality of our service offer, how we do things, but the opportunity to transform and do things differently. We are on a smaller scale, but with lots and lots of opportunity. So I wouldn't ever say we're broken. We are struggling to take the costs out as quickly as what we would like. And I think For me, it's definitely a timing issue. We have taken £24 million worth of cash out savings over the last 3 years, with a further 16, 17 identified to come out this year. This is cash out of this system and a huge amount of additional efficiency gains. We just need longer to be able to do that in a way which is safe and allows our staff to change and evolve and be engaged in those changes. We have been hugely successful in recruiting substantively to a lot of the workforce gaps that were in place 3 years ago. So we inherited a sort of 22% vacancy factor. As we've said in the briefing, with a couple of exceptions, we have now recruited to all of our consultant workforce, and we have dramatically reduced the number of vacancies for our allied health professionals and our nurses. But the consequence of that is that we now have staff who've got, employment contracts and rights. And if we are going to change services or do something different with their employment contracts, we have to go through a period of consultation and do that in a really appropriate way. So that is when you build sustainable health services. The downside is you can't just turn the tap off sometimes. And that's not what we would want to do. We are committed to building sustainable clinical delivery models with a workforce that is based here, that has all the expertise and training to deliver what Manx Care need them to do, and they feel professionally supported in this organisation. And I think we've got a huge amount of success around that. But obviously, we are struggling with our finances. Health and care is almost 80% workforce costs. So it's difficult to think about taking costs out of healthcare which actually don't take staff away, and that's why we've got to balance some of these thorny issues. But ultimately, we have to make the savings this year. But it's really important we have that conversation about what next year's settlement looks like and what we're going to have to do differently in preparation for that settlement.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.